Vaccines are some of the most thoroughly tested medical products that we have. Vaccines are safe, effective, and life-saving. But around the world, complacency among the public, coupled with misunderstanding and misinformation, is causing vaccination rates to decline with tragic results.
They have become the victims of our own success. Vaccine works very well, but now we see different picture. As the incidence of vaccine-preventable diseases diminished in recent decades, the perception of risk also decreased. At the same time, citizens have become more concerned about possible side effects.
A major basis for vaccine hesitancy in both North America and Europe, and now moving globally, is the false assertion that vaccines cause autism. And in response to that, I've written a new book called Vaccines Did Not Cause Rachel's Autism, which, as you can imagine, is putting me in the witness protection program. But it tells a personal story about Rachel's life and challenges finding employment and mental health counseling. But also it's a book that does a deep dive into the science of both vaccines and autism. It details studies on over 1 million children, reporting how children who receive their vaccines are no more likely to become autistic than children who are not vaccinated.
What we know is that online information can have very significant real-life impacts and consequences, some of which you have heard. And it's not just a domestic issue, but it reverberates globally. And seeds of doubt can be sown very rapidly by these sources. And trust is the underlying issue. And so in order to rebuild trust between parents, individuals, and their healthcare providers, we need to build environments where parents actually feel that they're heard and that their questions are going to be addressed.
Developing programs, education programs for vaccination of adults will improve coverage of vaccination in children, because vaccination is something which should benefit everyone during his whole life.
I want to say that what we need is a movement that, in a sense, goes almost beyond immunization. It's linking immunization to being a good parent. It's having parents feel pride that they are doing the right thing for their children.
A vacina tem que ser universal e a vacina tem que estar na agenda de todos os povos do mundo. Ela é um patrimônio. Isso veio de Jenner, isso veio de Sabin, isso veio de Salk. Isto não tem partido, não tem pátria. Isso pertence às crianças do mundo. E enquanto o mundo tiver crianças que precisam de vacinas, nós não podemos deixá-las à mercê de especulações fantasiosas sobre vacinas.
There is a huge measles outbreak in Ukraine. Over 100,000 cases have been reported since the summer of 2017. This is the result of years of anti-vaccination propaganda, disinformation, and lack of efforts. In 2014-2016, a lack of supply due to difficulties in procurement and delivery of vaccines because of external aggression against my country took its toll as well.
So it's just heartbreaking to see a resurgence of measles in the United States. It's a disease that had been effectively eliminated from our country, and it's reemerged with at least 839 cases in 23 states. Measles is a preventable but highly contagious disease, and the best way to prevent measles is with a safe and effective vaccine, which we have.
You know, there is a scientific consensus, a very strong one, about the safety of vaccines. And we need to make sure that we can keep coming back to that. You know, the algorithms are favoring sensational content over scientific facts. We're seeing this from, you know, from India to Kenya to Nigeria. We're seeing this happen, and it's not just in the standard social media platforms. The challenge for me is misinformation is the toolbox, and there's now commercial drivers of misinformation. You make money through the clicks towards that misinformation. And also, this is the really scary one, there's a political side now. You can destabilize governments by having both positive and negative information, which means that you confuse the population on, you know, can we trust our governments or not? Stop the misinformation, take it off the air. I remind people that this kills people. It's like other misinformation. This actually has a real cost. It's not a freedom of speech issue.
What's really clear is the way forward is together. There's no question about that. Not one entity in this represented in this room, not one country can go this alone.
Vaccines are one of the best investments in a healthier, safer world. Every year we estimate that vaccines save at least 2 million lives. Countless more children avoid debilitating diseases, prolonged hospital stays, and time out of school thanks to vaccines. Vaccines not only mean lives saved, they mean lives lived. But this is not simply an issue that can be managed online. Government, health workers, and health authorities have a vital role to play in building health systems that parents trust and believe in. Vaccination is a right and a shared responsibility. It will take long-term efforts, political will, and continuous investment to ensure we are protected together. Because there can be no health for all without vaccines for all.